Hi, welcome to the Dr. Paul Show. I'm Dr. Paul. Today I'm going to talk about full remission and what that means in the field of mental health. But before I get into it, please like and subscribe in order to stay informed about the topics that are important to you. So when I first see patients, one of the opening questions I ask them is, when did you feel the best in your life? And this question sometimes shocks people a little bit. They don't expect it. Because they have to really stop and think about it. And they sometimes say, well, what do you mean? I say, well, look back in your life. Where would you go back in your life where you felt your best, your happiest, the least stress, your best mood? Where would that be? And I hear a lot of different answers. There's two most common answers I hear. The most common I hear is elementary school. So why elementary school? Because in childhood, your life is more about having fun. You play with your friends. You go out. There's not a lot of worries in life. You're not stressed about things so much. Life's more carefree. Now this is again, if you have a healthy childhood. Now this is if you have loving parents that aren't abusive. So if you have a happy, healthy childhood, that can be a really happy time. The second one I hear is late teens to early mid-20s. Why then? Well, because you're out of high school, you're starting a career, you might be in college, or you might be starting in a career. And life's more about having fun. You go out with your friends. There's less stress. You don't have a lot as responsibility so much. As things might change later, like with marriage and kids. Not that that's bad, because it's great, but it's more stressful because life gets a little bit more complex. Now, people, when I tell them that I think I can get you back to that place, they don't believe me at first. They think, this guy's got to be kidding me. There's no way that he can make me feel that good again. What are the times I rarely hear? I don't usually hear middle school. I sometimes hear high school, but not usually. I sometimes hear 30s, but not usually. So why not? Well, again, like I said, it's when life gets more stressful, job stresses, financial stressors, relationship stress, breakups, loss of jobs. So there's a lot of very stressful things in life that happen to people. And so what I do basically then is I take a really good family history, because genetics gives me a lot of clues as to why the person's at that place where they are. So I take a really detailed history of their mothers, their father, their siblings, their grandparents, aunts and uncles, cousins, because family history is really, really key for me to understand why the person's at where they are at. I also ask about, other things about hormone changes. So why middle school? The reason middle school is not so good is puberty. So when people start having hormonal changes, women it happens more than men, which is also why depression and anxiety is more common in women than men, because women have more abrupt hormonal changes. So, but that's why middle school is often a very stressful time, because it's a whole change. Your feelings are changing, your emotions are changing, anxiety is happening more. And so that's why adolescence is a very difficult time for a lot of people. A lot of my patients I see a lot of people who are teenagers or in the early teen years because of this reason, because that's where a lot of chaos starts happening. That's where a lot of drug use starts happening. That's where a lot of behavioral problems start happening. So a lot of people I see also in midlife, and again, the other times of changes are, for women premenstrual. So that's why some women the week before their period have a lot of problems with irritability, moodiness. women after childbirth is a difficult time, and postpartum, and then women and men going through menopause, women going through perimenopause, so sometimes late 30s, 40s, 50s is a difficult time. And with men too, with men I call menopause or male menopause, which is also known as midlife crisis. So a lot of men also go through a really difficult time during those years because their testosterone is lowering and they're having their own hormonal changes different than women. And so when I tell people I can get you feeling back to that way, like as I said before, a lot of people say I can't believe that. I love trying to prove them wrong. So what I typically do is I'm usually able to get people back to that state of being within usually 2 to 3 visits, believe it or not. It sounds like unrealistic because I think a lot of people have this notion that with these medications that it takes weeks and months for them to work. That's just not true. The way I do things in my practice is I move very quickly. I make very quick changes because medications, and if you watch the show, you know that when I explain how they balance your neurochemistry, the point of balancing chemistry that's gone out of balance is that restoring that old feeling back again. So before those chemicals went out of balance is when the person felt their best. So my job with medication is to kind of get those chemicals back on the right track, going the right way instead of the wrong way. And that's what that's what psychotropic medications do. They're not addictive. They're very safe. But I'm able to usually figure out fairly quickly how to get people to that state. I start them on something. I talk to them a week later when they call me. And again, I work very, very quickly because my goal is to get them back to that state of being as soon as possible. Most of the time, I'm able to get people back to that state within 2 to 3 visits, within maybe 1 or 2 months at the most. Sometimes it takes longer if it's a more complex problem, but for the most part, it's pretty easy to get people back there. And when they are back to that state, and I'll ask them, sometime when they come back in for the next visit, I tell them, how are you doing? Oh, a lot better. I said, okay, you were telling me before that you felt better when you were at this state of, are you there? And they're like, either they say, yeah, I'm there. Great. Let's say, and if they say, I'm getting there, I say, okay, to quantify that, let's say 100% is there, and then 0% is where you felt your worst. Where are you right now? And some of them might say 50%, some say 75%. And then I'll ask them, okay, what's when you say 75%, what's the other 25%? What's not better? And when they tell me, well, this is not better, or I'm still not sleeping as well, I'm still having pain, I'm still having a little bit of anxiety. It might be that I need to adjust the medications better. I might need to add something into the mix. So usually, every visit, I'm thinking about how do I get this person to remission, and again, remission is the state of total well-being, where they don't have anxiety anymore, they're not depressed, they're sleeping great, they have great energy, they don't have pain. A state of being where they originally never thought they would get there, and they do, and they're shocked sometimes. And then when people get to that state of 90 to 100%, I think, and sometimes I do a little bit of tweaking, but other than that, I say we're good. And then now my goal is to keep you there. So then if I see them back and they slip back a bit, and they say I'm not quite as good as I was, I go, what's different? And they tell me, I go, okay, I think maybe the dose is too low. Let's adjust this. So I'm able to figure out fairly quickly how to get people to remission and keep them there. A lot of people have been to doctors who tell them, oh, this medication will take about 3 months to start working. That's never been true. That's a myth in this field of medicine, is that it takes medications long to work. the medications that I work with, if you know what you're doing, you get results within the first week of taking them. Maybe at the outside 2 weeks, but normally within 4 days even you see results. So they work a lot quicker than people think, and I think a lot of doctors are not aggressive enough. They do like, okay, we'll start you on this, and then a month later we'll go a little bit higher, and then over here. So then we're taking like 3 months to get to a place where they're not that much better, and okay, well, let's stop it and try something else. So now we're going months and months without the person getting better, and that person might either give up at that point and say, well, this is not working for me. Well, it's not that it's not working for you. The doctor just doesn't know what they're doing, and they don't know how to do this correct. They don't know how to be more aggressive, or they have this notion that they have to take things very slowly. That's all nonsense, okay? If you're seeing a doctor who's not getting you better quickly and just doing the same thing over and over again, it's time to change doctors, because obviously the doctor doesn't know how to do it correctly. And that's a lot of doctors, okay? Not just primary care doctors, sometimes also psychiatrists. My focus is not only the emotion, but also the physical body. And a lot of doctors don't do that. They don't think about the headaches, the neck and back pain, the fibromyalgia, the irritable bowel syndrome, all these things that people have that are mystery illnesses because doctors don't know what to do. So they'll give people pain pills. They'll give people things that are going to get the symptoms better, but not cure the problem. I'm constantly focusing on the balancing of the system, because once you balance the nervous system properly, then a lot of things fall into place. And so, again, I don't rest until people are there. And once I get them there, I want to keep them there. And it's amazing, if you do it correctly, the patients are just so overwhelmed and happy and excited, and then they tell their friends, and then I get a lot of referrals from people who come and see me and say, hey, can you do for me what you did to my friend? I can't believe the difference in her or him. Can you please help do that? I want that for me. I love to hear that, because I love doing what I do. I love seeing the results firsthand. It's always exciting to me. I never get tired of it. And that's what drives me to keep doing what I do. So that's basically full remission, what that means, and it's the goal for every patient I see. Every visit with every patient, I'm always thinking about, how can I get them closer there? If they're not there yet, what can I do now to get them there by next visit? And sometimes, you have to make choices that it's not the right choice. I give them something that didn't work, okay. It's trial and error. Because the thing about this field also, there is some trial and error. I have to try things to see if I'm right about something. And it's rational trial and error, but it is still trial and error. And that's what science is. Science is basically all about that. Because we don't have in this field, we don't have blood tests. We don't have scans. We have you telling me what's wrong and me trying to figure out, is it something I can do to fix it? And a lot of the times people get frustrated because they go to the doctor, they get a bunch of blood tests, the doctor says everything is fine, and we can't find anything, there's nothing wrong with you. And the person leaves frustrated because, what do you mean nothing's wrong with me? How can I feel like this? And you say nothing's wrong, but there's got to be something wrong with me. Well, yeah, there is something wrong, but the problem is the doctor's too focused on the tests and not listening to the person and looking at a piece of paper and saying, well, there's nothing I can do because all these things are normal. Well, those things are just a very small part of a person. That's the blood system. This is the nervous system. It's a whole different system that you can't test in that way. So in what I do, the medications are the tests, and they're also the treatment at the same time, and that's very unique in medicine. And there's no other field of medicine that's the case, because everything else in medicine, you do something according to a test. My test is listening to my patients. My test is patients telling me what's wrong, and so the patients are the test, and they drive me to be able to try to figure it out based on what they tell me. That's why with doctors, you have to have good listening skills. I do a lot of listening. On the show, I do a lot of talking, but the basis of what I do is listening, and that's the basis of communications is listening. And if a doctor's not a good listener, then they're not going to be able to do this very well, because there's no other way of doing it. So I hope you enjoyed this video, and please, if you liked what you hear, please share it with your friends and family. And if you have any questions or comments, please send them to me. I answer every question and every comment, and love to hear from you. And thank you for listening.